everyone. I'm Colleen Frangos, Rocket IT's Community Relationship Coordinator, and welcome to another great conversation on Thrive Gwinnett. Today, I've got the pleasure of talking to another fabulous member of our community here. And I get the opportunity to have some good conversations, real conversations about people making positive impacts and really banding together in their particular role to help support our community and make sure that we are thriving. So today I am joined by Annie Valenty. She is the Community Development and External Affairs Officer for Children's Healthcare of Atlanta. So welcome, Annie. I'm glad you're here.
Thank you. Thank you for having me, Colleen. I'm excited to be a part of this and excited what you are doing with Rocket IT and this podcast. It's fantastic.
Thank you, Annie. I appreciate it. Well, you are absolutely, no stranger to this community. I think you are very well respected, well known, and in your role at CHOA, you've been there for 8 years and some change, right?
Yeah.
I think this year has definitely brought about some challenges. And before we press record, talking about being a transformer, with what this pandemic has brought us, I would love to hear from you, Annie, just a little bit about what is going on at Children's Healthcare of Atlanta and in the response in the transformation that has come about due to all things coronavirus.
So one of the great things about working at Children's, and just to go into my role, is that I get to be out in the community and talk to families and be on the forefront of understanding how people are dealing with things.
Mm-hmm.
And so this has really helped in this particular situation, if not many. But with the coronavirus coming in and just kind of hitting us all in the face beginning of March.
Yeah.
That's the only way to say it. I will say that one of the great things about Children's is we're always just focused on the impact on children and how that not only the children, but the impact also on the families that they are a part of and how we can work as a resource to help them through all those situations. So this year, as the pandemic developed, I guess it just kind of, I don't even know how to say how it started in March. For me, it was March 14th, and it feels like everything just kind of screeched to a halt.
Mm-hmm.
And we are really great in our organization at prepping for that. So we saw it coming, we were prepared for, and from that way, we may not have been as prepared as we have liked, but as best as we could. And one of the things that we started to do as an organization is look in the community and see what can we do, what needs can we fill, not only clinically, because, we had doctors and nurses, they were born to serve, and they were ready. You bring your baby in, we're ready to take care of your baby, whatever it takes, that's what we're going to do. But not only there, but to say, this is going to really have an impact on kids. It's going to have an impact on families. How do you express the fear that parents feel? How do you express the fear that children feel? How do you express all this together in a healthy way and help them process it? So one of the things that we did, which I was really, really proud of, is we have a Strong for Life program that's part of our organization. And Strong for Life is really focused on the whole child, their physical well-being, their emotional well-being, all of it together. And so they really took a step back and said, this is our time to shine. Mm-hmm. And they went through a whole different set of analysis and came up with a program pretty quickly for parents to teach them how to talk to kids about this, how to really deal with this. And it's not just a different, not just at the same level, because what you want to say to a 4-year-old is very limited as opposed to what you want to say to a 14-year-old.
Absolutely.
I think that is one of the things that I really loved. Clinical, our nurses, our doctors, all of our clinical staff, those are our heroes. Mm-hmm. But I just love, as an organization, Children's embraces every aspect of a child and family and tries to serve in that way. So that's what I think has been great so far this year with us. And Absolutely. We've really been able to, as we say, transform the situation and try to help.
Yeah, no, and it's a collective effort. I think everyone has a role and has a hand in trying to make lemonade out of lemons. We did talk too, Annie. I mean, here we are. We're recording this on December 15th, and it's a remote recording, of course. But it's also we're back at the height of cases, and it's really snowballing and quickly. And I know for your folks over at CHOA, it's got to feel very heavy right now. And with the holidays upon us too, there's some heavy hearts, and I think trying
Mhm.
to keep spirits up and trying to really support folks maybe on the mental front. I think a program like that can really help as well. Are you guys seeing that, right now, standing, still in time? How's it going?
Well, one of the you're absolutely right. Our staff has really been faced with this for we're going on our 10th month, really
Mm,
facing into that.
right.
And yeah, really today we're entering into the 10th month of this. And
Hmm.
there is definite fatigue. There's definite fatigue, but
Yes.
there's also community support. That's one of the things that's great about Gwinnett.
Hmm.
You know, Gwinnett really wants to support each other. And if it's just a message of support, or I will say right now, we're also in the throes of holiday season, which at the hospital is amazing at the
Hmm.
same time because everyone is so generous to our patients. No one wants to be in the hospital, particularly a child at
Right.
Christmas. And
Right.
this community, I just told you today, this morning, I went and picked up 600 toys at a local
Yay.
office, and that's what we're all about. And so I
Right.
think that what we're doing as an organization and what we're doing even as a community is
Hmm.
trying to break that down relationship by relationship.
Hmm.
So, it's supporting your next door neighbor who's a nurse or a doctor and saying,
Hmm.
I really, really appreciate you, because it's those little relationships that weave together a more positive
Yes.
attitude and really
Hmm.
a force to deal with what we're dealing with. And you're right, numbers are skyrocketing. We're seeing our schools really, they're challenged right now by
Hmm.
the amount of quarantining they're doing right now, or they're just going
Right.
virtual to finish it out in some
Hmm.
cases. But we're hoping that if we continue to face this one moment at a time together and keep empowering each other, that's really going to help us pull through. And it's really like
Yeah.
taking care of your neighbor. I wear a mask,
Yes.
not necessarily because I love to wear a mask, but because
Oh,
I
I
don't
know.
want to give whatever I have to someone else, right? And
Absolutely.
that's an act of love. And so that's what this is all about all year round. It's those little acts of love that we can do for each other that say I'm really caring and doing that. So that's how we've been facing it. I think just individually as an organization is trying to support each other a little bit by little bits.
Love that. Well, in one thing, I think that support comes in all forms, and
Mhm.
love in all forms. And I would love to see, when we share this recording with everybody on social, um, moving into the new year, 2021, I think it's going to be just that, slow and steady race. But how are you gonna, I guess, transform yet again with how we can continue to support Children's Healthcare of Atlanta as a community? Is there going to be, I know the way people have been able to engage with you all, typical volunteer efforts, typical, donation drives, it's all organized differently just as a
Yeah,
result of the pandemic. Are there going to be some opportunities for folks to partner with y'all in the future? Just what does that look
absolutely.
like?
Absolutely. You've hit the right note. This year we're an events focused organization. We love to come out and do things with your
Right.
kids. Our Strong for Life program wants to be in
Hmm.
your schools. We
Yeah.
want to host events for kids. We want to be part of all different types of events. But yeah, we've really been on hold for that.
Hmm.
I am really hoping that in the new year, and
Hmm.
it really is a slow and steady thought. I hope that people understand that January 1st, there's not a curtain that drops and
Right.
this disappears, right?
It's not
And I
magic.
think everybody gets that. I think
Yeah.
everybody gets that. But this is a marathon. This is not a
Hmm.
sprint.
Hmm.
And we have to take this one day at a time and just
Hmm.
know this is the mileage I have to do today, to keep that analogy up. This is what I have to
Yep.
do to keep going. And
Yep.
before you know it, we have the vaccines that are starting to come out.
Hmm.
Hopefully we will see by mid-year. Yes, you'll definitely be able to see us engaging. If all goes well, then we hope we'll be able to be out there and engage with fundraisers, with
Hmm.
community events, and within the schools. It's really
Definitely.
important. We need that interaction. We were made for that
Yes.
interaction. you know
Absolutely. Human nature.
Absolutely, absolutely. And I think, just one thing I want to add, through all of this, which I think everybody has really tried to grab hold of, and sometimes you lose it, is hope. I mean,
Mm-hmm.
we really need to focus, even in this season, it's it's the holiday time. We really want to focus on hope, but this whole year has been a gift in many ways, and people don't see that much. But yeah,
Wonderful.
so I think that families, not an opportunity to really get to spend time together
Yeah.
and simplify their lives a little bit and really see, you know what, this is what's important. This is what's important. And I know my kids loved all their schedules, but I mean, the
forces you to slow down.
Yes, absolutely. But I think that is something that everyone has taken away this year, including our organization, is there's hope in every direction. You just have to look for it.
I love that. Well, that's when I was talking to CTR Partners, Jason Ferguson. He's been doing highlights of hope, and there you go, right there.
Yeah.
I love it. So, Annie, I think that's all we got time for, but it's been a very worthwhile conversation. I appreciate you, the work that you're doing in the community and with Children's Healthcare of Atlanta. And I wish you all the best. And thank you again for being here today on Thrive Gwinnett.
Thank you. And thank you for letting me be a part of this. And thank you for being such a positive force for us in this community. I appreciate it. That's great.
Absolutely. It's all I know how to do. So. And same to you. So, all right, Amy. Well, everybody, thanks for tuning in, and I hope you enjoyed our conversation today. And I look forward to the next episode of Thrive Gwinnett. Bye.